Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. As reported in the 2019 review article in the journal Food Science Biotechnology, nearly all men develop signs and symptoms of prostate enlargement by the age of 80. But does it have to be this way? More and more studies are showing that the prostate gland is very much influenced by dietary and lifestyle factors in addition to the aging process itself. So studies are showing that there are lifestyle practices that can help prevent prostate enlargement, reverse prostate enlargement, and protect the prostate from some other very undesirable outcomes. So how does it all work? Well, as men age, the prostate gland typically converts more testosterone into dihydrotestosterone, or DHT. And when DHT builds up in the prostate gland, it causes the prostate cells to divide at a much faster rate. So this increases the number of prostate cells, and hence the size of the prostate starts to increase. Now, an enlarged prostate gland, known as benign prostatic hyperplasia, or BPH, as the prostate enlarges like this, it puts pressure on the urethra, which then inhibits normal urination. So the typical signs and symptoms of enlarged prostate glands would be a very weak urine stream, difficulty initiating urination, and incomplete voiding of the bladder, leading to more frequent bathroom visits. Now, over the years, many studies have shown that the natural agent saw palmetto can reverse many cases of mild to moderate prostate enlargement problems. In fact, the use of saw palmetto as a medical treatment for prostate enlargement is very common in many European countries. Now, the 2019 review article on saw palmetto and prostate enlargement highlighted three really important mechanisms through which saw palmetto has been able to prevent and treat benign prostatic hyperplasia. So the three mechanisms that they highlight are these. Number one, saw palmetto constituents can block the conversion of testosterone into dihydrotestosterone, or DHT. There are fatty acids and sterolic compounds in saw palmetto that inhibit the enzyme that converts testosterone into DHT. That enzyme is called the 5-alpha reductase enzyme. When you inhibit that enzyme, you slow the conversion of testosterone into DHT. And by blocking DHT buildup, it prevents the prostate cells from dividing too quickly, which otherwise leads to prostate enlargement. And as you block that DHT buildup, over time, the total number of cells in the prostate starts to shrink again, so you can reverse mild to moderate BPH problems. Clinical studies have shown that. The second mechanism that's very important is that experimentally we see that if you take human prostate cancer cells, that certain constituents in saw palmetto can actually encourage those cancer cells to commit suicide, what we call programmed cell death, or apoptosis. So experimentally, some constituents in saw palmetto have been shown to cause human prostate cancer cells to commit suicide, which may imply that saw palmetto can also help to prevent prostate cancer from developing to some degree. So that's just an important consideration. The third mechanism that they identify is this anti-inflammatory effect. Saw palmetto is also shown to produce anti-inflammatory effects on the prostate gland, which has been identified as another mechanism through which you can prevent and treat prostate enlargement problems by reducing prostate gland inflammation. So in my view, because men over the age of 40 tend to increase the concentrations of DHT in their prostate gland, it makes sense to be proactive and help the body keep this dangerous hormone in check. Now, eating soy foods on a regular basis is one way to do this, as soybeans contain isoflavones, which also block the conversion of testosterone into DHT. But taking a supplement that contains the standardized grade of saw palmetto, along with other synergistic natural agents that support prostate health, to me that makes really good sense. So I personally like a supplement product that combines the following prostate support nutrients. I like the combination of saw palmetto extract, beta-cytosterol, Pygeum africanum, soy extract, stinging nettle, and lycopene. I recommend this combination to all my male patients over the age of 40. Each of these nutrients has been shown in clinical studies to be beneficial in helping to reverse benign prostatic hyperplasia. But I think that preventing prostate enlargement in the first place should be the priority for all men. And the fact that some of these natural agents also show promising anti-cancer effects in prostate research makes this strategy even more compelling in my view. So I've included the 2019 review article reference on saw palmetto and benign prostatic hyperplasia in the text below. I think this is a very important topic to be aware of for all men over the age of 40. So thanks for watching, and I'll see you next time.